appears that you're having some discomfort, we're just gonna make like both sides this morning. So I'm gonna be doing a two movements in you. It's all gonna be doing the movement in your neck. So I'm gonna be taking your neck into bending forward and then back. I'm gonna be side bending it to the right and left, and then rotating your head to the right and left. It's gonna appear like uncomfortable for you, but I really need you to relax the whole time. I'm gonna be putting two of my fingers between those joints to be able to see if they're moving too much, if they're moving really normally as compared to the other segment, or is moving less. If there's any pain while I'm doing that testing, you need to let me know, or if that will reproduce your headaches or your pain in the neck, please do let me know. Second part of my testing is the accessory testing. What I want to do here, you're going to be face down. I'm going to be pushing on your small joints in your neck. If your patient's not getting it, I usually show his spine itself. So I'm going to make it here to make it easier for Gabby. Then they just have no anatomy background. So the same thing, this is passive. That means I'm going to be doing all the movement myself. So I really need to relax your neck, and you're going to be face down. So you have those joints on your neck, the right and then the left side. But at the same time, you have those bony prominences on top. So I'm going to be pushing the middle one first, directly down towards the floor. See if there's any limitation of movement, if there's any stiffness, if there's any pain, or if that's going to even reduce your headache, or if it feels better. You do let me know. So just use this sign, thumbs up towards the ceiling. If it's okay, if it's really creating some discomfort or pain, if this is your problem, you can just put a sign down, and then I'm going to be constantly getting your feedback as we go along with the treatment. Is that sounding okay? And then I'm going to be really close to your neck, so if there's any discomfort or structure, if you feel like I'm pushing you too much or putting too much pressure, you do let me know, because I can always adjust my force. Okay? So that's just a classic example. You don't need to follow that, but just make sure you can really relay that message to your patient, because you're so close to the neck structure. You want to be able to have that confidence level in your patient that they're trusting your hand. So we're going to do your face-off position first on your back. I'm going to do this quickly again, your pivot assessment. So let me just adjust your table. Just going to start with just moving it, so don't let me just relax the whole time, okay? I'm just going to be doing the upward cervical spine, so just the basic nodding. Okay, in a neutral position, palpating inferior to my mastoid process, separation for flexion, decrease in soft tissue tension for extension. Rotate 30 degrees to the right side, the same exact thing. I'm just feeling for separation, and then decrease in soft tissue tension inferior to my mastoid process with my two fingers. Any problem with that? And then the same thing on the right side. Just do this, okay? And then just relax. Any problem with this? You're guarding a bit. You don't like that movement. No problem with this? So it feels like stiff to the left, okay? C1 and C2. Yeah. Okay? And then what I want you to do, extend all the way back towards here. I'm going to be supporting your head across. Oh. That's good. You're good. Yeah, you just crushed my quad, so I'm just kidding. All the way back. All the way back a little more. T7, T1, T1, T2, a little more. And then do me a favor, put your hands on your sides, okay? I'm just going to be feeling the movements of your neck here. Just relax. Flexion, intersegmental for separation, and then neutral in between the spinous processes. I'm just bending. Let me do all the work. I'm just feeling for any stiffness. And then I can grab it until C7, T1. I'm going to do your C2-3 rotation to the left. Just relax. I'm going to do a posterolateral segment. Let me do all the work. Good. Much better. Believe me, I can lift your head. I got it. Good. And then I'm just going to do the same thing on the other side. Just relax. Try to open your eyes, okay? Good. Any problem with this? She doesn't like rotation to the left. So she's really stiff there. So I'm going to use her as my patient again for treatment later. And then the same thing, just relaxing, just gonna be side bending your head, the other side. Always go back to neutral. No problem there? Be really careful with your finger placement. You don't want that way in your patient's face, so I'm just really using two. And then it's going to be lowering it slowly. Just relax. Good. Interspinous processes again. Okay. All the way back for me, please. Can you go face down for us now? Yeah?
For C7-1, are you palpating spinous processes and on the posterolateral, like facet?
The same thing, yeah. Exactly. So for my flexion and extension, interspinous, rotation and side bending, posterolateral. So I always like to do it away from the side so I can really feel it, but you can do both sides. But I want you to just practice on the opposite side so you have a better feel of it. So Gabby, this is the one that I explained before, that I'm going to be pushing your glute joints right here towards the floor, okay? If there's any problem, you do let me know. And as I said, you just give me a sign. Yep, it's like that. Or if it's really painful, just lower, your hand that way, okay? So I'm going to be doing the C2 UPA again. I'm going to start to lower this all the way, 2 to 3 oscillations. C3. Any problem? You have some stiffness there, correct?
Mm-hmm.
And as I go down, I can just feel like she's a little tight. So mid-lower cervical for her is really not moving a whole lot as compared to the other one. So let's do your OA, your C1 transverse process. 8-finger rule. Direction of your force again, you could even go to the side of your patient. You could just go towards the ipsilateral eye. Okay? And then C2 on 3 just directly down. And then if you want to do your C2 on 1, the same point of contact, actually going to be, we have the same size pretty much. Of the, rotate to the side. C2 on 1. So you almost want to go angled in this direction towards her mouth. And then what I want to do here, C2 again, I'm just going to go down. So I'm grabbing the soft tissue on this side. General hypermobility from that side as well. C2 on her right. If you're sliding, you're not doing this approximation in your patient's neck. So you really need to be able to have that direct PA force. And then let's do your rotation in this side as well. So I'm going to be on my C2, rotate. And just angle yourself that way.
What do you mean by sliding? Like sliding your hands down to each neck segment? Or is it-
No, I'm just I'm sliding my body to be able to have a direct PA force.
Your body,
Yeah.
okay.
So in terms of like the angle of the alignment, so you might need to do that. So when you're doing towards the eye, I need to like side bend my trunk towards the mouth, side bend to the right side.
On this one, are you pushing on the set joints?
Which one?
The head rotated.
I'm still on the TP on my patient. Yeah. So directly UPA and the transfer process. If I want to do the facet, I just need to go above and below, in between the spinous segments. But you can still do them. Okay. If you feel like you're in the transverse process of that element itself, and the patient's head like that reproduces my numbness and tingling, where would you probably be? Where is your finger? Maybe you're on the facet joints because you're on that foramina opening in your patient. Okay. So this is what we want you to do this morning, and your partner. The people on my right